Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. I'm joined by Lanette Siragusa, Chief Nursing Officer for Shared Health. Today we're announcing 9 additional deaths due to COVID-19. There's 1 death from Southern Health, Santé Sud, and 8 deaths from the Winnipeg Health Region. I want to extend my condolences to the families, friends, loved ones, caregivers of these individuals. The current 5-day COVID-19 test positivity rate is 13.6% provincially and 13% in Winnipeg. 241 new cases identified as of 9:30 a.m., taking our total to 21,264. I want to start today by addressing the vaccination booking that took place this past weekend. Determining our first priority group for the vaccine was quite a balancing act to help protect healthcare workers who provide direct care and are at greater risk of acquiring the virus, and the very small amount of doses available. We also considered what we know about the vaccine itself. We know that for some people the vaccine can cause fever and other symptoms. And so our healthcare system is already seeing challenges across the system. So we felt that if we focus the vaccination on a single subset of healthcare providers, it could have serious effects on our ability to provide care for a short period of time if those fever or muscle aches came on in a certain subset of healthcare providers. So we knew the priority group was going to be larger than a 900 initial doses of vaccine available. We know that for the coming months, demand for this vaccine is going to be much higher than the supply. We do expect more vaccine to be arriving as possibly early next week, and then we can move to protect even more healthcare workers through vaccinations. So far, about 2/3 of the available immunization spots have been filled. We know that the phone system over the weekend had been quite frustrating. Many healthcare professionals were required to call many times and wait for hours sometimes to finally get their appointment. The system put in place had to find a way to screen out people who weren't eligible, and so that's challenging. It's not simply just an appointment-based program. We needed to screen out people who weren't eligible. The phone number that we shared with eligible healthcare providers got released publicly, and so there's hundreds of thousands of calls made in relatively short periods of time. Unfortunately, there are many people who were not honest with the initial screening approach. So many of the call center attendants were dealing with screening out people who tried to screen in, and set a delay up. So, we know many Manitobans want to be immunized, and our plan is to have that available to any Manitobans. But right now we're going to have limited supply, and we need to make choices on how to best approach this. So even though there was a frustrating experience, our goal was to try to have all 900 appointments booked by end of day today, and we are on track to do that. And again, I would remind that we don't have vaccine yet in the jurisdiction. So even though it was quite a frustrating process over the weekend, our program is not delayed at all. We plan to go ahead with the vaccination program right on schedule. So apologize to everyone who had a frustrating experience, but our program is moving forward, and we're working on ways to improve that booking process. Coming up onto the holiday season, so we know that it's a time of year for office parties, gathering within families. Obviously this year is different. Many people have been working from home or in the office on a limited basis. We definitely need to hold our office celebrations this year, in-person ones. It would be great to find ways to do that virtually. A lot of creative ways to try to do that. We also know that this isn't the time for family gatherings. This is a time of year where that's normally quite the parties that get underway. But this year has to be different. This year we're going into the holiday season with a test positivity rate over 13%. We must socialize only with members of our household, with limited exemptions. If we gather over this weekend, over these coming weeks, we're going to see an escalation in those cases. So very difficult this year, but we have to find that way to celebrate virtually, reduce your contacts to household members only, practice the fundamentals at all times, try to maintain our household contacts as our only contacts as much as possible, going out only for essential reasons. We're going to celebrate differently this year, but we're planning on having vaccines administered this week. And so it won't immediately change the way we need to adhere to the public health guidelines, but we do have that hope that moving forward, we're not going to have to keep this way forever. That we will be able to celebrate once again with the loved ones. We'll be able to gather with loved ones again. But right now we need to stick with our plan and keep our contacts down. So thanks again, and I'll pass it over to Lanette.
Thank you. Good afternoon, everyone. Before I get started on the stats of the day, I wanted to start by thanking for the outpouring of support that our healthcare workers have received over the past few weeks. We've been receiving cards and letters of support from children who have embraced the needs for all of us to do what we can to protect ourselves and our loved ones from this virus. I wanted to share a quick excerpt from a 13-year-old who wrote us. His name is Phoenix Morpheus, and he writes, "What does dying mean? It means families, friends, brothers, sisters, cousins, uncles, aunts, dads, moms, sons, daughters, grandparents, people who didn't deserve to die, to suffer, or be scared. They can't give their loved ones a last hug before they die. Imagine the suffering and terror knowing you or your loved ones might not live, or play in the park, or breathe without a machine. Think about the big picture, and we will get through this together." So I want to thank Phoenix for his letter, and I wanted to congratulate both you and your parents on the upcoming birth of twin siblings. And your mom's going to do great, and you're going to be a wonderful big brother. And thank you very much for you and everyone who has written such kind letters of support for our staff. It really does help them to get through the day and remember that they have a lot of people behind them doing the right thing. So thanks to everyone on that. With regards to our health system and the capacity, it continues to be strained due to the surge of COVID patients. The acuity of the patients remains high and often requires complex interventions. This morning, there were 386 COVID patients in hospital, and this includes both 303 patients who actively have COVID, as well as 83 patients who no longer are infectious, but still hospitalized and requiring inpatient care. Due to technical issues, we do not have the data of hospitalizations for the Prairie Mountain Health region, so I'm just going to give you the Winnipeg-only ICU stats. In Winnipeg, we are at 154% of what our normal pre-COVID activity is as of this morning. There were 105 patients in our ICUs, including 47 patients who have COVID or have had COVID and are past their infectious stage, but still sick. 34 of 64 patients who are on ventilators also have COVID, and that's in Winnipeg only. As well, an estimated 2,750 elective and non-urgent surgeries were postponed in November. And this number is really a comparison compared to last November, looking at the volumes of surgery done. These postponements are necessary in order to free up system capacity, both beds and staff, in order to manage this COVID surge. But it is important to remember that although these are elective and non-urgent procedures, they are still necessary procedures, and there are still people who are waiting and whose quality of life may be impacted by this. So the sooner we can get back to doing our regular surgeries, the better it will be for everyone. Public Health is reporting 16 COVID outbreaks in 10 hospitals throughout Manitoba. They're also reporting outbreaks in 49 personal care homes in the province. Paramedics are continuing to assist as needed at Fairview and Grandview care homes in the Prairie Mountain Health region, and the Canadian Red Cross continues to provide assistance at various sites. I also wanted to provide an update on the number of positive healthcare workers who've been infected with COVID. In the past week, 83 healthcare workers tested positive for COVID-19. 1,044 healthcare workers, including paramedics, were tested. And the high number of positive cases identified in the past 7 days also reflects the ongoing efforts to clear the backlog of cases that were not identified previously. The 83 positive tests include 51 healthcare workers from Winnipeg, 12 from Southern Health Santé Sud, 11 from Prairie Mountain Health, 5 from Interlake Eastern, 2 from Northern Regional Health Authority, and 2 cases who have yet to be identified, but they are in our workplace. Broken down by profession, this past week's number include 2 physicians or physicians in training, 20 nurses, 54 allied health or support staff, 3 paramedics, and 4 yet to be determined. Additionally, more work is underway to address the backlog. In the past week, we've seen an additional 284 positive COVID cases involving healthcare workers and paramedics since the beginning of the pandemic. So that brings the overall number of positive cases since March to 1,348. Health Science Centre Winnipeg began a pilot today to support remote home monitoring for COVID patients. The Virtual Outpatient COVID Monitoring Initiative, otherwise known as VCOP, allows low acuity patients to connect regularly with a care team during their period of self-isolation or following discharge from hospital. This is to be able to support individuals who may require home oxygen during their recovery period. So what will happen is a physician will monitor the severity of each patient's symptoms during regular virtual visits. If symptoms worsen, a paramedic may be dispatched to check the vital signs or complete blood work. And in the case of severe symptoms, a patient may be transferred to hospital to meet the escalating needs, healthcare needs. So we are looking at scaling up this project as soon as possible and taking it province-wide, but we will take a few weeks at least just to work out the kinks at Health Science Centre and move progressively from there. We expect this will help with patient flow and also increase our ability to care for patients where they're at, closer to home whenever possible. And it will improve care for patients also longer term as we use these virtual solutions as potentially a new way forward for healthcare workers and patients to interact. And finally, one last reminder that a new walk-in testing site is now open at the Garrick Centre. And the hours of operation are 8 to 4 daily. And this is to better serve the Winnipeg's downtown population. And with that, we can open the lines to questions.
Thank you. A reminder to our reporters on the line, you will have one preliminary and two follow-up questions this afternoon. Up first, from the Winnipeg Free Press, Danielle.
Hi, good afternoon. Dr. Roussin, when it comes to the vaccine booking protocol, why did the province opt to use a phone line? Why weren't select staff offered appointments for vaccines based on their employment profiles rather than having to deal with a free-for-all on the phone?
Yeah, well, as we expand our criteria, then things like that would be much more difficult to accomplish. So one of the benefits, one of the reasons for having this small amount of doses ahead of the program was for this reason, to iron out growing pains, the hiccups, because we want to be able to understand things like the average time it takes to screen a person calling for this. So we wanted to use this as a chance to evaluate a lot of our program, because going forward, we're going to have increasing amounts of vaccine supply, so we can't just specifically invite individuals going forward. So we needed to we really want to take this opportunity to go through some of these growing pains, and you see it with every time you initiate a program. This is quite a large one, so we're still going to book all 900 appointments. We're still going to have those delivered on time, and now we've learned a lot for as we expand our program.
Okay, thank you. I wanted to ask you about schools as well today. So while you've said that there is low transmission in schools, you've also said that there are many sources of infection in Winnipeg that are unknown or can't be traced. Schools are one of the few indoor congregate settings that are still open. So how can you confidently say schools are not contributing to community transmission of the virus at this time?
Yeah, well, we've been following that population quite closely. We have a number of protocols in place to that were there to minimize the risk of transmission, and all of our health or education partners have really stepped up to that. And so we do extensive case evaluation. So we have the cases certainly there. Most of them we can link to community being acquired in the community. And then we do extensive contact tracing and follow those people who were in contact with that case while in school. And we just don't see a lot of secondary transmission. Certainly it happens. We certainly see transmission, but it's not to the level that we're seeing in the community. So we follow these numbers quite closely, and based on that, we're just not seeing a lot of transmission.
Thanks. We've also heard, or the Free Press has heard from teachers who report being pressured by public health to, limit the number of student contacts when they're asked to identify close contacts of a case in a class. We've also heard from parents who work at home and who get COVID, but they're told not to take their child for a test, even though that's like the only exposure point, outside of their home bubble is their child going to school. So can you explain why it seems like public health is sort of leading investigations away from schools?
I don't know if I understand the details of that. Public health would be doing a contact investigation, and that's what public health nurses are expert in, and so they would identify cases and then look for close contacts, and so based on that, that's who they would identify as close contacts. So they wouldn't be trying to deter someone from naming someone as a close contact, but they'll go through what actually is a close contact, what requirements need to be taken, need to have occurred to be a close contact. And then as far as testing goes, we don't recommend a lot of asymptomatic testing. Certainly contacts of cases, should be self-isolating for their incubation period. Sometimes we do recommend contacts to be tested at certain days. But other than that, that's how public health has been dealing with this and will continue to.
Afternoon, Brittany from Global. Dr. Roussin, the vaccination clinic, there was a walkthrough this morning for media that got to see a look at that. I'm just wondering if you can explain what some of the differences people can expect to see at a COVID vaccination clinic as opposed to, say, a regular flu clinic.
Well, I think that right now, early on, probably the biggest difference is that this is a new vaccine. We're going to have very scarce resources, so we're going to have a lot of screening up front to ensure you meet our eligibility criteria, and then screening to ensure you're eligible to receive it. So this, quite a new vaccine. So in the studied groups, there are things like immune compromised individuals, individuals with autoimmune conditions, pregnant women were excluded from the studies, so we don't have a lot of information. So early on, we're not going to be providing immunizations in that respect. As far as the nature of the vaccine, it's very likely that we will be able to provide vaccines to immunocompromised, to those with autoimmune diseases, but it's just very early on. We're still gathering information. So that'll likely be one of the biggest differences is just the amount of screening that we need to do before providing that immunization.
And we started seeing the first vaccinations happening in other provinces. Can you tell us when this vaccine is going to be in Manitoba and why it's taking till Wednesday to have our first ones rolled out?
Well, it's a distribution chain. So some jurisdictions received it. It's hard to get it in all jurisdictions at one time, and so we're expecting to receive it this week, and then we'll have our clinic off and running as soon as feasible.
Thank you. And we've heard from some groups that have concerns right now, places like certain First Nations, Peguis is one, for example, that are allowing extended family, students, off-reserve members to come home for the holidays. Is there exceptions for reserves, or is that something that still has to follow under Manitoba's guidelines?
Yeah, so for specifics related to what a community has in mind, I'd refer you back there. Our public health orders, and certainly the advice is to avoid gathering from outside of your household. There's some exemptions to that are listed in the orders, but we have to be really careful this holiday season. We're starting to see some trends of our numbers coming down. We're in a very critical restrictions. If we let our guards down, if we have a lot of gatherings, even on just one day, we're set up for a lot of transmission, and we'll start seeing the results of that a week or two after the holiday. So my strong advice is to limit any gathering outside of your household. My advice is to follow the public health orders as they're written, and really keep your guard up this holiday season. I know it's difficult, but like I said, we have a vaccine on the horizon. We have every reason to believe that next year's not going to look like this, but we have to get through this year.
From the Brandon Sun, Colin.
Hi there. I know that you're still waiting for vaccine to arrive and for the list of people who are getting the vaccine from the first wave to be completed, but I was wondering if either of you know roughly how many people from each health region are going to be immunized in this first wave.
I don't have those details. I'm sure when we have our completed bookings there, we'll be able to have some sense of that, but I don't have those numbers.
My second question is, we've had numerous readers reach out to ask about their children who are either required to or want to come home from their post-secondary schooling for Christmas, but they're not quite sure how the rules figure out and apply to them in that scenario. How should parents of post-secondary students be handling that situation this Christmas.
Yeah, and so again, so the overall messaging is to do whatever you can to limit your contacts to household members, right? There are exceptions in the orders, but they're not there just to to have if you're able to avoid having any other people in your house, then that's ideal. But we realize there are situations like this where children may be, living outside of the home and need to find another place over the holidays. The orders do allow for that. I would say, I would keep in mind that if that is coming from east of Terrace Bay, those people will have to self-isolate, meaning they can't have close contact with others in that family, in that household for the 2 weeks. But otherwise, we would, advise practicing fundamentals to limit any gatherings from outside your household, realizing that there are some exemptions and some necessities.
Thank you. And my final question is, we had someone who lives near the Essesby ski hill near the Saskatchewan border wanting to know why, they're not allowed to meet with friends and family this Christmas, but the ski hill is still allowed to have people from different parts of the province visit and patronize that business.
And so I think that, from the orders, from probably every step of the order, there's going to be individual circumstances that may not fit perfectly. Now, my advice is that we need to focus on decreasing our level of contacts, not focus on bits of the order that may not apply directly to you, because we're at a critical juncture. Our hospitals are full. So our focus should really be on just reducing the amount of contacts any way you can. When we talk about being outdoor recreation, the group sizes of 5 still apply in those areas. The indoor facilities are largely shut, and people must maintain that distancing when you're not part of that group. So there's a lot of safeguards that are in place, and we know the benefit of outdoor recreation. And then we also know that the risk of indoor prolonged contact is just where this virus is spread. So that's where those orders come from. But there could be just individual circumstances where the orders may not fit just right. But that's knowing when we write orders, we can't do them to everyone's individual circumstances. So let's focus on keeping our contacts down, focus on getting through this holiday season, and and we'll get through this.
From CJOB, Alicia.
Hi, folks. If we can go back to the 100,000 people who tried to call this weekend, why did we do a phone line and not an online only booking system? I know you said earlier you wanted to learn some different things around screening. So as the program gets bigger, does that mean you'll only be using phones? Because we all know what happened when people tried to get in for testing, and I think people are worried there's going to be another schmozzle, like having to wait hours and hours and hours to make an appointment.
Yeah, and so we are planning on ramping up this capacity. We are planning at other capacities, such as online booking. So remember, we're hours into just booking appointments. We haven't received a single vaccine in our jurisdiction yet. So when we ramp up these type of things, we're going to see some, having some of those growing pains. We're going to learn. So we have 900 doses. That's not going to make a population, level coverage. It's not going to cover even, appropriately a significant portion of our health workforce. We're using this to learn, to grow as a program. And so, yeah, there was some delays over the weekend. Some were unexpected, and we've learned from it and continue. So we're not expecting to be behind at all in this dosing, and we'll just keep expanding that capacity as we get more and more doses.
Thank you. Speaking of learning new things, and the media is going through the vaccine clinic right now. So are you kind of treating the vaccine clinic as a bit of a test run as well? Will other vaccine clinics, as we get the program ramped up, will this kind of be a model for those ones as well?
That's right. So this gives us that opportunity for receiving the vaccine, storing the vaccine, having the logistics of the clinic itself. And so it gives us that run because we expect to have bigger clinics. We expect to be able to vaccinate many, many more people. We expect to have appointments for many, many more people. But this is the benefit of receiving that relatively small amount early, is we get to work through a lot of these things early on.
Okay, and for my final question, numbers from the province today tell us about 30% of Manitobans have received the shot for influenza so far. I guess I'd like your comment on that. Are you happy with the rollout? Would you like to see more?
We shipped out vaccine very quickly this year, so I was quite pleased with how quickly we got vaccine out the door. Remember, there's a significant delay in in counting those doses administered. They need to be administered and then sent in many places for us to enter into the public health information management system. It's very likely significantly more than 30% at this point have received. We wanted to, last year we saw about 26% of Manitobans take us up on the vaccine. We certainly wanted more than that and expected more than that and ordered more than that. 30%, I would like to see that number climb, and very likely we will see that climb.
From the Winnipeg Sun, Scott.
Hi, good afternoon to both of you. Dr. Roussin, just going back to the Peguis First Nation thing, would you be speaking to that First Nation or any others that are planning on doing this? I mean, I guess for a lot of other people, it looks like that, this is a clear flouting of the rules to allow a specific area to have people over on certain days, Christmas Day is part of it. Will you have a conversation? How do you kind of get compliance in a place that has, you've said many times, is one of the more vulnerable populations in our province?
Yeah, we're going to engage. I mean, we have been engaged with many First Nations, and we'll continue to engage and again try to get that message out. I mean, it's not hard to understand why people want to do this, right? It's understandable this time of year. But even for those days, even for a few days, if we let our guards down, we can see a lot of transmission. And so it's really important for us to get through this holiday season. We have this critical red restrictions in place for a reason. We saw that trajectory we were on that we've managed to head off for now. But I'm really concerned about this holiday season, that if we see a gathering take place, we're going to see a spike in cases 7 to 14 days after the holiday season.
Okay, thanks for that. Follow-up is, I guess other than asking nicely the next time we get more vaccines, how do you deter people from clogging up the phone lines when more vaccines do arrive in the province? Because, I mean, let's say you get another 900 or another 9,000 or whatever it might be the next time. I imagine you're going to run into the same problem as you did this time.
And so these are the type of things that we get the opportunity to learn from, how we can expedite that screening process, how we can limit people calling in. So again, it was, a lot of people calling in, and there's initial screening tests, screening questions with the keypad that many people weren't being fully forthcoming with, and still getting to an operator. And so that tied up a lot of time. And so, the message is we're going to have enough vaccine for all Manitobans who want one. It's not going to be for months, though, and so we need to be able to get this vaccine out to those that are highest at risk. And so we're asking only people who really believe they're eligible at the time to try to make those appointments, and we're going to keep working on the ability to try to streamline that process.
Thanks for that. And do we have? Can we glean anything out of the numbers that are the last couple of days? 2 straight days now with deaths under double digits. Cases are now, I think, the last 2 days in the 200 range. Are we gleaning anything now from that yet, or is it still too early?
Well, I think it's a little too early. We definitely want to see a downward trend of case numbers, and we expected to see more and quicker of that trend. I'm still concerned about the test positivity. Our test positivity rate isn't dropping as we wanted it to. And so we'll continue to follow that, to see geographic trends as well. But when we plot our absolute case numbers and look at that, we do see that trend slowly down. And we see that we're moving those scenarios. We saw during that modeling that we were in the worst case scenario when we implemented this critical red. We've now seen that we've managed to change our trajectory from that worst case scenario.
From CBC Radio Canada, Matthew.
Hi, my question is for Dr. Roussin. I have just one question. Some people doesn't know where to look or where to call to have a clarification on what is allowed to do or not. How do the Manitobans can get clear information and a better understanding of the regulation, for example, outdoor activity or outside gathering? You know what I mean?
Yeah, I mean, I think that there's, when we have these orders in place and then we, make some changes, we try to explain that to Manitobans. So I would encourage Manitobans to visit our website, manitoba.ca/COVID-19. There's information on there on, pretty much all about COVID and our regulations. And then there's links to be able to reach out for more information.
Thank you.
From CBC Manitoba, Aaron.
Good morning. Ms. Siragusa, you said the healthcare system is under strain right now. So many cases of COVID-19, many people in the ICU needing high level of care, and the hospital has limited capacity. We're still hearing from a lot of people who are wanting to find ways to mix or visit each other over the holidays or travel over the next couple of weeks, people that are trying to find ways around orders just so that they can see each other. What kind of an impact can we expect to see in the hospitals if that occurs?
Well, so just like during Thanksgiving when the people gathered, if people do the same thing over Christmas or New Year's, it just increases the potential to spread the virus. So we are not where we want to be yet, but we're going hopefully in the right direction. If we let down our guard, then we can expect probably 7 to 10 days after that we will see another surge in critical care, in hospitalizations. So we're hoping that Manitobans, it's going to be hard during the holiday season, but we're really asking everyone to make the sacrifice this season so that we can get through and not have a surge, not put more pressure on the hospitals so that we can get back to normal as soon as possible. So I would say it's usually what we see is about 7 to 10 days after the spread, after the event where people get together, that we feel it in the hospital.
Thank you for that. Dr. Roussin, over the weekend, I know you've been answering questions about the vaccines, but over the weekend, many of the frontline workers were trying to get through, and I've heard that that attempt to access the call was a little bit like the Hunger Games, trying to get a spot. And also, there are a lot of staff off right now who are, they have risk factors because of age or they have serious medical issues, and they feel that they'd be able to enter the system if they were able to have access or priority access to the vaccine. Is there any kind of a strategy, or is there room to streamline the strategy to ensure those that are on the front lines or that can soon be on the front lines will have access sooner?
So this is a challenge with a scarce resource. So we're going to have at first, we're going to have very strict eligibility criteria. And so right now we have those strict eligibility criteria. As we get more and more doses, we're going to be able to open up the eligibility to frontline healthcare workers, of course, a priority group, long-term care facilities, their workers and residents, and in remote, isolated Indigenous communities. So, it's going to, at first, we're going to have much fewer doses than what the demand is for. And so we'll do our best to try to, roll this out in a transparent manner, but in a manner that we reach our highest risk individuals first.
Okay, thank you. And Dr. Roussin, we know that COVID-19 is really impacting the homeless population, especially in Winnipeg, and low-income people right now. Also, when they come to get primary care, they often will come to the emergency department, and it's hard to find places for them to isolate. I'm just wondering what the situation is right now with the isolation suites for the homeless population, and how that's going in terms of getting people that need to be able to isolate out of hospitals and isolating.
Right now, we do have designated spaces for homeless population to isolate safely. We have capacity in those sites, and we are always continually trying to expand that capacity. We know that going into winter, it's going to become a bigger issue. So right now, we do have that capacity, and we're planning to expand regularly.
From the Canadian Press, Steve.
Dr. Roussin, I have a follow-up question on the problems you were mentioning with the telephone line. Were people dialing in and answering hitting the buttons? Were people pretending to be healthcare workers when they were not?
There was some reports of that. That the screeners were speaking to people who did not meet any of the eligibility criteria. So people were, whether on purpose or inadvertently, pressing the keypad indicating that they were eligible for this criteria. And then when getting on the phone, they were found not to be.
Okay, for Ms. Siragusa, I'm hoping to get a little more detail. I know there's some a problem with the data from Brandon, but what are the ICU numbers in Winnipeg in terms of how many ICU beds or critical care beds are currently available, and how many of them are occupied?
Well, as we've spoken about before, we do have the capacity to increase those ICU beds. There's about 27 that are situated there. They have the equipment and supplies ready to go. It would be a matter of putting the staffing teams together and deploying them, but there is about 27 open ICU beds this morning. And Steve, what else you were asking about the total number of people in ICU? So 105 patients in ICU today.
And can you comment on what the trend is? We've been seeing, the case numbers go down. What's the demand on critical care graph looking like, in recent days?
So it looks like the critical care beds are sustaining at a steady level. So there still continues to be people requiring ICU. They also continue to stay in ICU for a long time, and their acuity is high. Like it's a complex virus, the impact on people. So they require a lot of work and a long length of stay. So it's ongoing. Each individual is obviously different, but it is absolutely taxing on the healthcare system and our staff.
From CTV Winnipeg, Michelle.
Hi, it's Michelle Gerwing from CTV. I'm circling back to the vaccine call-in. You said you wanted to get an idea of the average time to screen. Do we know how long that was for these first 2/3 of appointments?
Well, it was, I don't have the details on the people who actually, actually qualified for it, but the actual time per screener per appointment was quite long, over 2 hours, because they were requiring to go through so many people to even get to one person who was qualified. So yeah, I think, like we say, it's we're not even an hour into the actual vaccine campaign. We don't have vaccine in the jurisdiction yet. We opened up. We certainly didn't want to keep our healthcare workers on the line that long and cause that much frustration for them. And we're certainly sorry that occurred. But it's it's a big program. It's in the early stages, and we need to expect some hiccups like this. But again, these hiccups are very unlikely to have resulted in a delay of even a minute for a single dose. And so we're still moving forward. We're going to get all these appointments booked, and we're going to have this vaccine program move forward.
Great, thank you. I know you've said repeatedly that we don't have any vaccine yet. Our first round is about 900 people. Do we know what our next shipment might be? I'm just hearing Alberta is expecting their second shipment to have about 25,000 further doses. Does Manitoba know?
Yeah, we've gotten an idea of some of these doses here. I'm not sure when we will release the details. I think we're still waiting for some finalization of that, but we are expecting further doses in the upcoming weeks, and we'll let Manitobans know of the size of that, as well as how we can expand our eligibility criteria at some point.
Great. I'm also wondering about the recoveries. We now have close to 15,000 people listed as recovered. Is that backlog fully caught up on?
I think that we're probably still overestimating the amount of active cases we have. We say for the most part, people who are recovered, they recover 10 days after symptom onset. And so if you look at a 10-day rolling average of the amount of new cases we have, you'd think around there would be an estimate of the amount of active cases we have. There are some exemptions to this, or exceptions to it. Some people who are, quite ill or immune compromised might take longer to recover. There's some people who have symptoms, longer. But, for the most part, if you look at that 10 days average of new cases, that's about how many active cases we have.
From City News, Stephanie.
Hi there, Stephanie Lasuk from City News. Dr. Roussin, I just wanted to get your reaction when you first heard that some Manitobans were trying to jump the line and get ahead of frontline healthcare workers for the vaccine.
Yeah, I heard first I was, concerned over the weekend when I heard from a number of my colleagues reaching out that they were having difficulty getting on and getting appointments, and so that was sort of the initial concern. We later found out in that day that line had been made public, and then a lot of ineligible people at this point were trying to call in to get appointments. So, I think it's. We're in a pandemic. It's people are worried, and so I think it's understandable where people are reaching out wanting to get that vaccine. I think that for in one aspect, it's very good that we have high demand for this vaccine. We're going to need a high proportion of Manitobans to take it. But it really challenged our ability to provide that the service we wanted to our healthcare providers who were eligible. So we're really reaching out to Manitobans to not try to jump the queue, We're going to have strict ways of trying to ensure that only eligible people get it when they can. So we're asking to Manitobans not to try to jump that queue.
I wondered if you could kind of go over why it's essential. Again, I know you went over it last week, but why it's essential that the criteria now for eligible people is what it is.
Oh, like for a vaccine, yeah. So, so we have to balance it with that. We only have 900 doses, so that's one. So we need to find that. There's a number of healthcare workers that are increased risk. And so healthcare workers who work on the front line are certainly at increased risk of acquiring the virus. They're frequently exposed. And then there's certain healthcare workers that are not only increased risk of acquiring, but might be more increased risk of severe outcomes based on age. And so we just looked at the numbers. We wanted to spread it out, not to focus on just one area of clinical practice, and so these were the numbers that we came up with. And remember, it's just very early on. We wanted to get that subset of 900, and really work out a lot of the kinks in the program.
Sure, and I know that this is something that's super hard to predict, but you had told us last week that, or we were told last week that about 7% of Manitoba's population was expected to get the vaccine by the end of March. Can you just give us any kind of idea you might have on when the average Manitoban might be able to get their vaccine, or when we'll have enough to establish herd immunity?
Yeah, and so it is difficult. We're not going to see that herd immunity effect in the first quarter. We can be fairly confident on that. But after April, we expect to be able to receive increasing doses of the vaccine, and over the following months, we're going to expect a larger and larger proportion of Manitobans to be eligible for that vaccine. So, we do need a relatively high uptake to get into that benefit from herd immunity. We're looking at over 60%, and we're thinking that we're going to have the demand to meet that.
Our final reporter this afternoon from CHVN, Taylor.
Ms. Siragusa, just to clarify, are any Manitobans being denied critical health care at this time?
No, they are not.
Okay, thanks. Dr. Roussin, before we move to red, you mentioned how there was the spread of COVID-19 at churches, but now, while we are in red and it's lockdown, there are still churches who are having difficulty to understand why they can't meet in person. Do you have any messages for churches who are struggling with these orders?
Well, I think that the message is for a number of different sectors. I think we hear the same from restaurants, hear the same from gyms, and often the message is that, well, we're, in our specific instance, we're doing everything we can. We're not the problem. And so I'm sure a lot of these sectors had stepped up, but we can't make orders based on individual circumstances. We know from the evidence around the world, from evidence right here, that the spread of this virus is prolonged indoor contact. And from numerous studies, we see that's in faith-based organizations, that's in restaurants, that's in gyms, and there just isn't a way around that. And so right now, when we have such a high test positivity, the risk of transmission of this virus in indoor settings where there's prolonged contact is just too high to allow right now. So we've always known it's difficult. We've always known that these establishments have no intention of putting their patrons at risk. It's just the nature of the virus. We're focusing on the virus, not trying to target any individuals.
And on the flip side right now, how can churches and faith groups help out right now? Could they be offering building space or encouraging volunteers, doing other kind of community outreach?
Yeah, I've had a discussion with many faith-based leaders, and that's exactly what they are. They're leaders. They're looking for ways right now to help out their community, help out Manitobans. And, you know, I've heard of recommendations on that they plan on trying to get the message out to, you know, to their followers about the importance of vaccine as more and more gets available. They've talked about being there for that mental support for their parishioners. And so I think there's a you know, a tremendous amount of suggestions that was brought my way, and we're going to continue to work with them. And really appreciate their you know, their work in finding ways to help out Manitobans in the meantime.
Thanks, everyone. This concludes our media briefing.